Welcome to IMCAS TV, 10 Minutes with dermatologist Moshe Lapidoth from Israel. And we're going to hear about your views on radio frequency. Just a little background on Dr. Lapidoth. You are the director of the laser unit at the Rambam Medical Center and the past director of the laser branch of the EADV, the European Academy of Dermatology and Venerology. Welcome and thank you for coming. Radio frequency, or as we say, RF.
Actually, I'm the president of the ESLD, the European Society of Lasers in Dermatology.
Excuse me.
Okay.
Perfect.
That's fine.
Perfect, even better. RF, or radio frequency treatment, is one of the latest treatments for improving skin tone, acne, scars, and cellulite. And it targets heat to the deeper dermal layers while keeping the top layer of the skin intact. And my first question for you is, how does it work? How does RF work?
It's very simple, actually. It works by rotating of water molecules. Water molecules are polar molecules. They have plus and they have minus. When the current, the RF current, is going through those molecules, they are trying to rotate. They are starting to rotate. And by this rotation, actually, heat is being created.
Mm-hmm. And what areas are best treated with radio frequency?
Actually, the radio frequency treatments today are, say, very versatile. You can treat the face, you can treat the neck, you can treat every and each part of the body.
Of the body with RF?
Yes.
And where are you getting the best results?
On the face.
On the face.
Face and neck usually will get the best results. It depends, of course, on the modality, on the specific device, but usually you'll see the best results on face and neck. But again, you can see a significant improvement on other bodies as well. Buttocks, you can see the thighs, you can see the belly.
Buttocks, thighs,
in women,
belly.
yes, post-birth delivery, post-baby delivery, you can see a huge improvement of the skin laxity. So it really works.
It really works. And it's safe and it's effective for all skin types, or are there certain skin types that you feel are better, more responsive?
Very good question. Actually, we can divide the radio frequency into 3 different categories. There is the bulk heating, which is totally safe for all skin types. There is a minimally invasive, which is, again, safe for all skin types because the needles are penetrating deep into the skin. So the skin type really doesn't differ, or that doesn't make any difference. And the third one is what we call today the ablation for fractional radio frequency, when you're actually ablating part of the skin, and that will be safe for skin types 1 to 4, 1 to 5, but probably not to 6.
And how does that work?
It works by ablation, but the electrodes are lying very superficially over the skin. When the current is going through the electrodes, it ablates the part of the epidermis and causing actually some improvement in the superficial, the texture of the skin, superficial wrinkles, lentiginous, and so on. But that is a little bit more aggressive procedure. So it cannot be applied on patients with skin type 5 or 6.
Right. And how effective is radio frequency in fighting cellulite compared to the other energy-based devices we've talked about today?
It's effective. It's very difficult to compare which device is the best, which means what we are using today is mainly combinations of radio frequency, ultrasound, and even light. And when you are doing the combinations and mechanical applications like vacuum, rollers, and so on, when you are doing all of them together, you're getting the best results. So there
all
is
of them
no
in combination.
In combination. So it's very difficult today to answer you which one of the modalities carries the best results. It's because most of the devices we will use different modalities
depending
together.
on the situation.
Exactly.
Each has a different use, purpose, and result. What kind of results are you seeing in your patients?
I
And
see significant improvement. Of
how
course,
long
I will
after?
tell you,
Yeah.
there is a secret covered in, which means you have to do appropriate patient selection. If
Ah.
you know what patient to choose, you can get really significant results, which means 70, 80%
And how
improvement.
do you know which patient to choose?
Oh,
That's
this is
the
the million
secret.
dollar question, you
That's the
know.
million-dollar
For this,
question.
we need, I think we need about 2 hours, which means I don't mind to sit here for 2 hours, but I think your time is limited.
Well, people are going to stop you in the
Yeah.
Congress and ask you for your secret. Um, how long do you see results after a treatment?
Again, it depends on the indication for the treatment. If it's the face and neck, usually you will see the results last much longer. It's not forever. The patients will need some maintenance therapies. If it's on the body, usually they will need a maintenance therapy every month, every 2 months. If it's on the face, usually every 3 or 4 or even 6 months. So it very much depends on the basic situation, what kind of or what was the degree of improvement, the age of the patients. There
The
are
skin
many
type?
factors, skin type, many factors can influence the results and the need for a maintenance therapy.
And from the time that the patient walks out of your office, how long will she see the results, visible results?
Again, it depends on the specific modality, but they will see the results very soon,
Very
in
soon.
few days, yes.
And unlike lasers, RF does not improve brown spots. Correct me if I'm wrong.
You are wrong today, which means the new modality, the fractional RF,
Does.
does improve, because it causes ablation, can improve lentiginous and brown spots.
Melasma, red spots.
Melasma, there is no any energy-based device that can improve melasma. There is a very nice paper that will be published soon about laser energy-based devices and melasma. Melasma, you have to understand, it's a dynamic process. No any static procedure, no any once done procedure can improve a dynamic process. We still need to use creams.
You need to, and so what problems can RF really target the best, in your opinion? The one target, the middle of the target, if you were shooting it, would be
My favorite one? My favorite is blood vessels.
blood vessels.
Yes,
So it's vast, yeah.
yes, but most of the people will use it for skin tightening and lipolysis and so on. But my favorite one is
Is
blood
blood
vessels.
vessels.
But you have to know how to use it, which means it's a little bit more complicated.
It's more complicated. And the new innovations in RF technology are,
There are many. There are many. Actually,
is it moving as fast as laser technology? Because laser technology is, excuse the pun, moving at
it's
the speed of
yes.
light. But,
But what we are going to see probably in next years to come is a home use device of radio frequency that will fractional radio frequency that will cause holes in the skin, and immediately after applying it on the skin, you will use some cream, some cosmeceuticals or pharmaceutical cream in order to improve your skin quality, which means that the fractional device, the home use device, will serve as a tool for better penetration of your cream
for the cream.
to penetrate into the skin and to get better results. Because one of the problems today of the cosmeceuticals industry is that if it's very effective, it's considered, if the ingredients are high concentrated, it's considered to be a drug. And it's
And psychologically, the word drug is associated with risk, complication.
risk, complications, and different regulatory processes.
Absolutely.
So the way to pass it is to use a cream, but to cause a better penetration of the cream. And how can you do it? You can do it but by radio frequency. And that will be the future. You'll go to your pharmacy, you will buy some cream from L'Oreal or any other provider together with a very small device, radio
In
frequency device,
combination.
in combination. First, you will apply this device on your skin, causing small holes, and immediately after, you will apply the cream, and you will be shocked. The results will be fascinating.
Thank you so much.
Thank
Thank
you.
you, Dr. Lapidoth. It was a pleasure. Thank you.